to another Medical Minute with Dr. Abiola Ajayi. I'm the MD CEO of ROA Specialist Hospital here in Lagos, Nigeria. And today we're going to talk about postpartum depression, also known as PPD. It's a underdiagnosed and misunderstood but very common condition that can affect women after childbirth and involves depression. So let's talk about the symptoms, the risk factors, treatment, and why you should get help early. So postpartum depression, or PPD, affects, in the US, 1 in 8 women. In Nigeria, 10 to 20% of women that are giving birth. That represents anywhere from 500,000 to 800,000 new cases a year. So it's quite prevalent in both countries. So how do you diagnose or identify postpartum depression? At times, people confuse this with the baby blues, and at times they're two in the same thing. But the baby blues usually last just for a couple of weeks. But when symptoms of hopelessness, difficulty bonding with the baby, excessive crying, withdrawal from family and friends, and at times thoughts of harming yourself or the baby. We've all seen some of these videos, either in the news or online, where a mother drowned the child or the infant, or shook the child, or did any number of horrible things. And most of those times when investigated, those women are suffering from postpartum depression. So it's something we like to identify early and often. Several things affect or are risk factors for postpartum depression, like sleep deprivation, which happens when you have a new baby. Exhaustion can also cause it. Stressful life events, when your partner is not supportive, or you feel like you're not getting the support you deserve. If you have a history of depression or mental disorders, you can have a higher chance of acquiring postpartum depression. And if you have hormonal changes after childbirth. So we all know hormones regulate pre-pregnancy, during pregnancy, and after pregnancy. Sometimes those changes can lead to some of the consequences of untreated postpartum depression are like what I mentioned. So a depressed person can harm themselves. It's a cause of maternal suicide. They can harm the baby or kill the baby, as well as can lead to the inability of the mother to care for herself and others because they're so depressed. So how do we treat postpartum depression? Oftentimes we treat it with counseling. A psychiatrist can be involved. Even a family practitioner or your general medical doctor can help you with these symptoms. At times we use antidepressants. It's not everybody that we have to put on drugs. It just depends on the severity of the depression. The good news is that most of these things can be treated, and it can be treated relatively easily and quickly as long as you reach out for help. It's important to know that postpartum depression, or PPD, or having any kind of difficulty is not a sign of weakness or a sign of failure. And at times, it's caused by things that are beyond your control. So if you have feelings of sadness, hopelessness, anxiety, don't feel connected to your child, or anything else I may not have mentioned, it may be cause for you to seek help. And if you are close to ROA Specialist Hospital, if you mention that you saw us on social media, we'll do a free consultation for you. So what do you have to lose? Please check out our socials, follow, like, subscribe, and even check out the website, www.theroahospital.com, and all the socials, Facebook, Instagram, and Twitter at ROA Specialist Hospital. See you next week.